Preventive measures and general advisory for novel coronavirus. Coronavirus is a contagious virus that causes respiratory infection and can easily transfer from human to human. Symptoms: fever, difficulty in breathing, coughing, tightness of chest, running nose, headache, feeling of being unwell, pneumonia, kidney failure. Incubation period 14 days, asymptomatic. Mode of transmission: human coronavirus is most commonly spread from an infected person to other through the air by coughing and sneezing. Close personal contact such as touching or shaking hands, touching an object or surface with the virus on it, then touching your mouth, nose or eyes before washing your hands. How to reduce risk of coronavirus infection? Clean hands with soap and water or alcohol-based hand rub for at least 20 seconds. Cover nose and mouth when coughing and sneezing with tissue or flexed elbow. Avoid close contact with anyone with cold or flu-like symptoms. Avoid frozen meat. Isolation of symptomatic patient for at least 14 days. Do's and don'ts. Do's: cover your nose and mouth with disposable tissue or handkerchief while coughing or sneezing. Frequently wash your hands with soap and water for at least 20 seconds. Avoid crowded places. Persons suffering from influenza-like illness must be confined at home. Stay at more than 1 arm length distance from persons sick with flu. Take adequate sleep and rest. Drink plenty of water, liquids, and eat nutritious food. Persons suspected with influenza-like illness must consult doctor immediately. Don'ts: touching eyes, nose, and mouth with unwashed hands. Hugging and shaking hands while greeting. Spitting in public places. Taking medicines without consulting doctor. Disposal of used napkins in open area. Touching surfaces usually used by public, example, railing, door gates, etc. Smoking in public places. Unnecessary testing. Excessive physical exercise. Employees who have symptoms of acute respiratory illness are recommended to stay home. In general, any contacts should be reduced to the essential, and the attendance of events with crowds of people should be avoided. Steps for washing hands: wet hands with water. Apply enough soap to cover all hand surface. Rub hand palm to palm. Right palm over left dorsum with interlaced finger and vice versa. Palm to palm with finger interlaced. Backs of finger to opposing palms with finger interlocked. Rotational rubbing of left thumb clasped in right palm and vice versa. Rotational rubbing backwards and forwards with clasped finger of right hand in left palm and vice versa. Rinse hands with water. Dry thoroughly with a single used towel. Use towel to turn off the faucet, and your hands are safe.